6:43 and new this morning. They are the words no one wants to hear. You have cancer. Once the fear subsides, there can be questions about surviving and treatment. And if chemotherapy is involved, this one. Will I lose my hair? Well, this morning, a Central Ohio breast cancer survivor is talking about a therapy that's helping her hair and what you can do to ensure it helps other people as well. Jen Ernst is a breast cancer survivor with some advice for anyone facing chemotherapy and hair loss.
Manage your expectations. So I think as long as you go in with realistic expectations and know that you will shed some hair and try to focus on the hair that you are keeping, not the hair that you're losing.
She's grateful to share her lived experience of diagnosis, treatment, and that fear of losing hair.
I just kept thinking about the looks of pity that I would receive or the unsolicited conversations in the grocery store from strangers.
Ernst chose to include cold capping, a treatment used to reduce hair loss in chemotherapy.
This is our freezer room where we keep the cold caps.
Bethany Golden, who owns the Over My Head boutique, told us that OhioHealth started its cold capping program about 4 years ago.
It's a cap that's about negative 30 degrees Celsius, and they change the cap every 25 minutes for an hour prior to their chemotherapy beginning, all during their infusion, and then between 3 and 7 hours following their chemotherapy.
Jen Ernst was able to keep nearly 70% of her hair and conceal what was lost.
Once that first cap kind of freezes those hair follicles, then each cap that goes on after it's fine. You don't notice the cold.
Cold capping is FDA approved and proves successful in people with solid tumor cancers, including breast, ovarian, and prostate cancer. It is an investment of time and money.
The average is about $2,500 per patient. Now, it's obviously less for somebody that does 4 infusion treatments and greater for somebody that would do 16 infusion treatments.
Chemotherapy took a lot out of Ernst, who was an avid runner. She's run the Cap City Half Marathon before, and she plans to run it again next year after she recovers. For now, she's elated to learn that part of the registration fee for Cap City goes to the OhioHealth Foundation, which subsidized every patient, like her, 75% to help with the cost of cold capping.
It will provide an opportunity to some women that may not be able to cold cap, and I really feel like whether if you have this option, every woman should have access to it.
It really is all about access. This is the 20th year for the OhioHealth Cap City Half Marathon. It's coming up on Saturday, April 29th. Registration is underway right now. And again, a portion of the fee goes to cold cap therapy, the program there at OhioHealth. So whether you're running or walking, it's a health investment in yourself and someone in the fight against cancer.
That's so special to hear that, you always wonder with organizations, like you put the money out there with registration fees and it goes to the right place,
right,
but you don't see it.
Yes.
And to see that this is actually helping with these expensive therapies is amazing.
My goodness. And it's so great that we're at a point where it is a therapy option, because it is one of the first things you think about, like, am I going to have chemotherapy?
Yeah.
And what's going to happen to my hair?
Sure.
Not because it's vanity, but because you want to be strong and present yourself as normal. You don't want to be the subject of conversation. That's one thing that Jen shared with us, is that she didn't want people to be talking about her in the grocery store.
Yeah.
And now they're going to talk about how great she looks and wishing her the best.
And how everyone's helping out.
Yeah,
with that program too.
My
Nice.
sister and I are actually going to do Cap City, so we'll be out there.
Okay.
Yeah, we're going to put our feet to the pavement. So, Maddie, we need to have some great weather to train in.